Well, hello and welcome to the latest coronavirus chat update from Neuse. I am your host, publisher of Neuse.com, BJ Murphy. Thank you so much for joining us. We meant to do this a week ago, and we had some technical issues. In fact, actually, our internet was down yesterday, so we were just excited to be able to be on your cell phone, on your laptop, or your tablet today. If you don't mind, go ahead and share this broadcast with those. We have Dr. Pradeep with us today. I'm going to introduce him in just a few moments. So if you don't mind, just take a quick moment and share this broadcast or tag a healthcare worker. Let them know how much you appreciate them, emergency services personnel as well. Thank you so much for watching and for joining us today. We got some important news, some important announcements I want to share with you today. The first one is that as of this morning, the North Carolina Department of Health and Human Services said that we have 13,397 cases of COVID-19 in our state, 507 deaths. In Greene County, we have 33 cases with no deaths. Jones County, officially they're reporting 19 cases. I believe Jones County says they actually have 18, but they do have 2 deaths associated with Jones County. In Lenoir, there are now 97 cases in Lenoir County, with unfortunately 4 of those cases being deaths. Another thing, and we're going to probably publish this afternoon. Just want to double check a couple things. There are 3 Lenoir County facilities on the pandemic outbreaks list across the state of North Carolina. That basically nursing homes, veterans homes, those kind of facilities, skilled nursing centers. The North Carolina State Veterans Home has 4 cases, 2 staff, 2 residents, and actually had a death, unfortunately. Spring Arbor has 16 cases, 4 staff, 12 residents with 1 death. And Caswell Center is new to this list. We had heard rumblings that there were some cases there, but they actually published them on this list yesterday afternoon. They have 6 cases there, 4 are staff, and 2 are residents with 0 deaths. So I want to make sure that you got the latest on that information. We will publish that report this afternoon, probably within 30 minutes to an hour after we get off air here. Also, today's question of the day in our We Report News Facebook group has gotten a lot of chatter, a lot of conversation. The question is, everyone seems to be having this discussion. So the question is mask, ? Or no mask, ? And we published it just about 3-4 hours ago. It's already got close to 100 comments. So a lot of opinions on that. We're actually going to talk about that with Dr. Pradeep here in just a few moments. So if you haven't joined our We Report News Facebook group, please do so. In fact, speaking of Dr. Pradeep, if you have a question for Dr. Pradeep, please go ahead and drop it in the comments below, and we will try to get that to those questions as this broadcast unfolds. The last thing I want to mention before I bring Dr. Pradeep on is we have a very special message from our partners at Lenoir Community College. This is a message we haven't shown before, and it's entitled, Keep Moving.
Good chances are most of us are waiting for life to begin again, waiting for the green light, the play button, the next chapter. But what if we didn't need to wait? The time we have right now is used for something life-changing. After all, time may have slowed down, but it hasn't stopped, and neither have your goals. Keep moving toward your goals and your degree with online classes through Lenoir Community College. Just visit lenoircc.edu today to get started. That's lenoircc.edu.
A lot of great opportunities at Lenoir Community College. We know that they've got some enrollments coming up real soon. So make sure you check out all the latest COVID-19 updates as well as the enrollments from Lenoir Community College at lenoircc.edu. You'll see that in the red ticker at the bottom, lenoircc.edu. In fact, if you have not registered for our breaking news text alert, please do so. Just text the keyword 48, the keyword NN, and send that to 484848. Again, that's the keyword NN, and send it to 484848. Well, now I'd like to bring on Dr. Pradeep. He's no stranger to this broadcast cardiologist here in our community. Dr. Pradeep, great to have you on this afternoon.
Great to be here.
So let's jump right into it. You know, we posed this question on our Facebook group today about mask or no mask, and you and I were talking about it just before, about a conversation I had with somebody at a store the other day about this. Tell us, in your opinion, your medical opinion, about this conversation of wearing masks in public or not. Is it beneficial? Let's have a conversation, and certainly look forward to seeing some of the conversations in the comments as well.
So the masks are controversial for multiple reasons. One, in the beginning of the pandemic, we didn't have enough. So at that time, uh, rightfully so, people were recommending that we should have the masks more, we should save them more for healthcare professionals. And if you remember, the Surgeon General said masks will can increase your chance of infection because you tend to touch your face a lot more and all of that. I mean, I understand all of that, but that was in the beginning of the pandemic. And then the most important thing to understand about the mask is it is not for your protection that you are wearing the mask. The mask is for the protecting the person you're talking to, the person you're interacting with. So if I am wearing a mask, I'm trying to protect you. If you are wearing a mask, you're trying to protect me. If you are not wearing a mask, mm, and I'm wearing a mask, it still reduces your chance of getting an infection. It may not reduce my chance of getting an infection, and I think it does a little bit, but not as much as you would think. The aerosolized particles are too small to be filtered by those regular surgical masks. The N95 mask will do a little better job, but still, the most important thing to understand about the mask is you wearing a mask does not may not help you as much, but it'll definitely help the other person. How does it help the other person? The way it helps is, let's say you cough, you sneeze. You all know this. There are big particles that can come out. If you had the mask on, these particles don't come out. If those particles don't come out, then it does not go into somebody else's body. The bigger the size of the particle, the larger the number of viruses in it. If there is any very little, let's say there are very few particles, then they will deposit in your throat and it gets washed off, or the cilia will take care of it. There are hair-like structures on your throat which will take care of it. Now, the if it's a multiple large particles and they go into your lungs, that's where you're going to get your pneumonia and all of those kind of things. So it is very important to wear a mask. If you go into Lowe's, if you go into Food Lion, if you go into any of those places, if you go outside, talk to people, wear a mask. Have I been good at it? Sadly, I have not been that great at it. I just went to Food Lion and completely forgot to put the mask on. While I was waiting in checkout is when I realized, crap, I didn't have the mask on. But this is something like everybody else, I have to learn too. I'm probably better than most people, but still, I would still consider myself terrible at it. Okay. But that is not an excuse. I will try to be better at it. Okay.
And tell us, let's talk a little bit about the effectiveness of the types of masks people are wearing. I mean, certainly the N95, something that surgeons use or painters use, for example. But a lot of people are wearing these homemade masks made out of fabric at home. Are these types of homemade T-shirt type, sock type mask actually real effective to reducing the spread of COVID-19?
There were some studies that looked at all of this. Remember, the mask, even though whether you look at it as from the N95, the surgical mask, or the cloth mask, there are pores in it, and depending on the size of the pores, it reduces your chance of getting the virus in. The N95 does a very good job of it. That would be on one end. On the other end, you would have the cloth mask, which the pores are too big to stop the particles from coming in. But again, wearing a cloth mask is always going to be better than wearing nothing. Wearing a surgical mask is going to be better than wearing a cloth mask. N95 is going to be better than wearing a surgical mask.
And what about some folks who say, hey, I practice effective social distancing techniques. I'm never, I use my app to pay for items in a drive-through, or maybe I'm effectively practicing the social distancing. I'm always 6 feet or more away. I'm constantly washing my hands, and I choose not to wear a mask. Are these people, in your opinion, still using good techniques, or do you think everybody who's out in public should have a mask?
BJ, that's the way I would think about it is, if wearing a mask would be one more step. Yes, you wash your hands, you do all of those things. It would be one more step that you can do. And it's an easy step. If it was a difficult step, I can understand. If it causes a lot of inconvenience for you, go ahead. I mean, I understand. But this step is not that difficult. All you have to do is to wear a mask, and it can reduce the risk of somebody else's infection. Yes, I would want you to do it. And the other thing to think about is, you know, the when you wear the mask, it reduces the particle size, right? So if you, let's say, for example, you're standing in Lowe's and you sneeze or you cough, you can't control it. I mean, yes, you're taking all the precautions, but you're still not able to control it. If you're not able to control it, then you're going to have particles aerosolized all over the place. So I would still suggest that people wear a mask. There are studies out there that show that when people sneeze, the particles can go up to 20 feet. So just 6 feet is not going to be enough. I mean, yes, the further away you are, the particles are going to be much less than when you're closer. So I'm not saying 6 feet is not a good number, but that's just an arbitrary number. Okay, so I would still suggest wearing a mask.
And thank you so much for that. And for everybody who's watching at home, the conversation we're having with Dr. Pradeep right now is about mask and no mask. And if you didn't get a chance to watch this, please make sure once we end this broadcast to go back to it. Please make sure you share this conversation with others, because this has really been a hot topic. It's the reason why it's a part of our conversation. We report Neuse News Facebook group today. And I just want to say a big special thank you to Karen Jackson, who just sent us stars in the comments. If you don't know anything about stars, it's just a new way to say thank you to a live stream like what we're doing right here with Neuse News. Basically, you purchase the stars, you drop them in the comments there, and Neuse News gets a penny for every star we're given. And so I just want to say a big thank you to Karen Jackson for the donation of those stars there. Back to Dr. Pradeep. Over the past week or two, there have been some conversations about the actual statistics on deaths related to COVID-19. And so there's been some conversation, I think you even made a post or something about it, related to how a death certificate is filled out. It's a position I've never been in. I hope I never have to be in. But as a physician, what are you hearing, or what are you seeing about how a death certificate is actually filled out and how that's playing into the COVID-19 numbers?
So I looked to try to find out how this controversy came about. It is actually two things that have been put together, which one thing has nothing to do with the other. First off, if you have a COVID-19 patient in the hospital, if you have a COVID pneumonia, okay, you automatically get 20% more reimbursement. Okay, so that's the first thing. So if you come with a regular pneumonia, let's say you get $1,000 for the hospital gets $1,000. It's probably more, it's probably less. I have no idea what you get, but let's say it's $1,000. With COVID pneumonia, you will get $1,200. Okay, so people think, oh my God, then now hospitals are all going to code everything as COVID-19 to get that extra $200. But what people don't understand is a COVID pneumonia patient utilizes a whole lot more staff, a whole lot more resources. For example, if you have a COVID pneumonia patient and you're on an IV, we have to have extenders to put that IV outside the room. And every time you walk into the room, you have to change 4 pairs of gloves, a mask, a shield. And then think about all the people checking your temperature and everything for people walking into screen. So it increases your cost tremendously. It does not even break even with what they're paying. Every COVID-19 patient is going to lose a lot of money for the hospital. So and that is why they increased it by 20%. That 20% really didn't make any change. Now, so then somebody took that and went to the next conclusion that, okay, people are putting COVID-19 as the cause of death for all these patients. The CDC has sent out a circular saying for a death certificate, if you think the patient had COVID-19, even if you didn't have the test, you would put it as COVID-19. And that also exacerbated the whole thing. And now there's this people going around on Facebook and on other social media too, saying that this is all bogus. People are increasing the death rates for COVID-19. So now coming back to the death certificate. So this is where the problem is. The death certificate has two parts, a part 1 and a part 2. The part 1 is where you put the immediate cause of death. So let's say you had a heart attack. Or let's do something simple. Let's say you had pneumonia. You came into the hospital, came in with a pneumonia, and then while you were in the hospital, because of the stress of the pneumonia, you get a heart attack, and then you die. So the way I would fill the death certificate would be in part 1, the top line would be heart attack. We would call it myocardial infarction. The second line would be pneumonia. Then on part 2, I would put in diabetes, high blood pressure. The part 2 is where you put in things that would have influenced it. Because if you had diabetes, then your chance of dying with a heart attack is much higher. So that's how you would fill it. So let's say a patient came with COVID-19 and died because of sepsis and died because of renal failure and high potassium. The way we would put the diagnosis would be hyperkalemia, which is high potassium. The next line would be renal failure, because that is what caused the high potassium. And the third thing would be sepsis, which is what caused the renal failure. And the fourth would be COVID-19, which is what caused the sepsis. Okay. So
right.
Now, so where does the confusion happen? The confusion happens when you have a person coming into the emergency room and they say that they are in contact, they have had contact with COVID-19, or they're traveling from New York, come to the emergency room, and they just pass out and die. They were very short of breath, they pass out and die. The chances are this is COVID-19, okay? You're looking at probabilities. You would put COVID-19 on the diagnosis there. You don't know for sure, but you would still send the test to confirm it. If it comes back negative, they take that off the death certificate, okay? So, and if you think about it, as a physician, I don't have any incentive to diagnose a patient as COVID-19. I don't get a 20% pay increase because I put it as COVID-19. The hospital may get it, but why would I want to jeopardize my license so the hospital can make 20% more? So this is a manufactured conspiracy, as like all other conspiracies.
Mm-hmm.
This is a completely manufactured conspiracy. This has no validity to it. Nobody is doing it. Are there some idiot out there who has done it one time or twice? Maybe, I don't know. I mean, I can't prove what I do not know. But I can tell you,
right.
You would have to be a really dumb physician to be coding something that you don't think is COVID-19.
Well, I appreciate the clarification on that and the explanation on that. I hope everybody watching, I could see some of the comments, so people really appreciate that excellent information there. Let's talk a little bit about, real quick, tomorrow, the governor's phase 1 implementation goes into effect at 5 p.m. Do you have any thoughts about phase 1 and as we look forward the next couple of weeks?
Mm-hmm. So if you look at the governor's plan and President Trump's plan, they follow very closely. Okay, for the governor's plan and Trump's plan, what they wanted to show was the test. The percentage of positive tests had to come down or stay flat, which means you're not getting more cases than normal, or the cases have to come down. Now, the second thing, and then that's testing, and then we had to trace. All of that is slowly falling into place. So now the governor is going to open it into phase 1, which is going to open up a little bit more businesses. Retail is going to go up by 50%. All of that is a good thing. Now, over the next 2 weeks, if these numbers continue to go down, then we will go to phase 2. And then I believe it's 4 to 6 weeks that the numbers have to go down before we go to phase 3. Now, the one concern I have, though, is if you look at the current numbers, the current death and all of that, it seems to be there's a small uptick in the last few days, which does concern me. I'm hoping that it's just a statistical anomaly. I'm hoping that in the next few days it starts coming back down again. Because if it goes back up, the plans, including Trump's plan, is to shut it back down, because we will have to.
And it looks like, what I've seen is that people, and based on what I have viewed and watched the tea leaves and seen how many cars on the road or people in the stores, is that as we've gotten more data and probably better data, that people have started making some of their own decisions and have ventured out of the house more, whether that's because they're actually watching the data or they're just, you're getting a little stir crazy being at the house so much. And, my suspicion is that between the mix of the increased number of tests that we're already doing, we're testing 50% more today in North Carolina than we were a month ago. Between the increased number of tests and people getting out more, that my suspicion is even with the phase one, that we're probably going to see a little bit of increase in the number. The question is, how much does that play into the governor's willingness to go into phase two based on his guidelines? So I'm really curious about that. And thinking about COVID-19 stats, have there been any other trends that have concerned you about it?
So let me backtrack and clarify one thing.
Okay.
So the numbers, I do expect the numbers to go up because the testing is going to go up. But remember, if you had more testing, okay, the percentage of positives should not go up. If the percentage of positives continue to go up, that means it's more cases. Okay, it's not because of the testing; it's because you have more cases. So the percentages have either have to stay safe, flat, because right now it is at 7.9%. If it's at 7.9%, it better stay at 7.9%. If it's going down to 7.8 or 7.7, that's a good sign. If it is going back up to 8.1, 8.2, go up to 10%, that means you're having more cases. That's one thing. The second thing is the most important graph that I would follow would be the death. Because you cannot cheat death, sadly, you cannot cheat death. All you can do with
that's a good point.
the deaths will be a true statistic to follow. But the disadvantage of deaths, though, is it lags behind by around 2 weeks. So that's the one thing. That's one thing that worries me right now, because if you look at the North Carolina new deaths and the U.S. new deaths, they are starting to climb back up a little bit. Again, I'm hoping it's a statistical anomaly. We will hopefully it'll come down in the next few days.
Yeah, and also when in regards to actual testing, the fact is, even right now, as much testing we've done, we still don't know the true number of active cases across the state. Mm-hmm. And there's no way we really can do that because there's no physical probability where we can test 100% of the population. So the question is, are we ever going to get more tests so we can do more testing? Because if someone said, hey, BJ, for $10, you can take this test, or even for $50, I get it for the whole family without thinking twice about it. If it was available on the commercial market, a little bit easier for us here. So hopefully we'll get more testing. I do want to, thinking about politics and how that policy and how that affects from a medical perspective, Lenoir County commissioners, they released a letter that they signed yesterday, and it was addressed to Governor Cooper. And basically, this was signed by 8 other counties of government. And I'm glancing at it. It was Beaufort County, Carteret, Craven, Jones, Onslow, Pamlico, Wayne, and Lenoir. And without getting to it's about 3 or 4 paragraphs. You go to newsnews.com, you can actually click on this and read the entire letter. But addressed to Governor Cooper, I'm going to mention a couple lines here. They basically said, we appreciate your leadership. Many of the decisions you've made saved lives, helped flatten the curve. Like you, we've had to make difficult decisions. It's been challenging. They said these orders have placed an extreme economic hardship on our local county economies. We no longer can sit idle as these orders cause vast economic despair and irreparable harm to our small businesses and citizens. And they're saying, as a region, we ask that you authorize local control of decision-making in regards to a phased reopening approach. So basically, in a nutshell, it looks like what the county commissioners are asking the governor is, and the governor alluded to this about a week or so ago, this idea that they may look at clusters of counties and give them the authority to do their own phased reopening. What are your thoughts on that?
So if it's clusters of county like Eastern North Carolina and stuff, I don't disagree with it. But my problem is, where do you stop? I mean, if Jones County has a different opinion from Lenoir County, if Jones County opens up and Lenoir County does not, or the other way around, and the Jones County person wants to come into Lenoir County to do shopping and do whatever stuff, do you let them not come? I mean, how far smaller do you go? Then now if Kinston says no, I don't care what Lenoir County says, Kinston wants to do its own, the city wants to do its own thing, Do we let them do it? I mean, and then if Kinston says, fine, we'll go with it, but what about East Kinston, which is different from the rest of Kinston? East Kinston says, no, this is going to affect us differently, so we want separate. I mean, these are all tough decisions. I don't know what to say here, because half of our county commissioners cannot agree on simple things like fixing roads. I mean, so a big deal like this, with including death and a disability, I'm not so sure they're well equipped to handle it.
I was actually in Jones County today working on a project there related to their census, and I just can't imagine someone, a sheriff department, stopping me at the border to check my citizenship, whether or not they'd even allow me in. So the idea of enforcing even our county lines seems like something virtually impossible with this. But the idea of the regions trying to work together does make sense. But the challenge here is that there really is no perfect answer, and the counties are trying to have the counties are asking for a little bit more local control on this. There was a question earlier, and I'm sorry, Doctor, I didn't get to it, from Deanna Griffin. She said, when will they have free tests to check to see if someone has COVID-19? She mentioned that there was a possibility of them doing it at Walmart in Greenville. I didn't hear any stories about free tests at Walmart in Greenville. But are you hearing any talk of tests that can roll out to the entire market? I heard LabCorp a couple weeks ago come out with this commercial grade test they were working on, but you still had to get it ordered through your doctor. I'm not hearing anything where you can actually go to Walmart and buy a test, go home like a pregnancy test, and just take it and determine where you are on that. Have you heard any chatter about the availability of more testing?
Not yet. There is no way. You still have to go through your doctor's office to get testing. Now, I was looking at her question, and she said about free testing. Now, I want everybody to understand, for now, all of that testing is considered free. Whether you have health insurance or not, it will be done. Okay, so the cost part of it is not something you need to be worried about. If you wanted testing done, it can be done, but it has to fit the criteria. You have to have symptoms, you have to have travel history, or you have to have contact with the COVID-19 patient. Okay, and it has to be ordered by your primary care physician. But even now, the number of tests is still very low. So and that's the reason why it's not widely available.
And another question, going back, thinking about the statistics from the Department of Health and Human Services, one thing I'd like to point out, or at least get your thoughts on this, on their public dashboard, which we decided to stop publishing the data every single day. We decided just to start doing it on a weekly basis because we're getting inundated with data now, and I think it kind of gets drowned out. So every Friday morning, Neuse is updating our NCDHS dashboard, as well as how it affects us locally. But one thing the Department of Health and Human Services is doing is reporting the number of laboratory confirmed cases. And what they're saying right now, as I mentioned earlier in this broadcast, that there's 13,397. What they're not saying in this dashboard is the number of active cases. So, based on this, at a glance, I'm not able to see how many of these almost 14,000 people have actually recovered. So the numbers it looks like, always continue to go up, but there's not a true, here are the number of active cases that we're aware of. But you made a good point earlier, and that was, you can't cheat deaths. So the deaths number at the end of the day is one that we should probably be studying the most.
Yeah. Now, so people always want to know the recovery rate, and I understand the reason for it. I mean, it frustrates me then when people keep focusing on the recovery rate. But the problem, though, is that is not a rate that you can adequately find. I mean, the reason being, what is the recovery rate? Is it being not dead? Being not dead, is that a recovery rate? Or would you consider 20% of your lungs being destroyed, but that's okay, you're still recovered? So, or you have a little bit of liver damage, but you're still recovered. So there is no uniform definition on what the recovery rate is. If you went home, is that considered recovery? I mean, so And it does not give you any useful information other than to give you a sense of 70% of the people recovered, 80% of the people recovered. Okay, you feel good about it, but that's not the point of this data, right? I mean, the point of this data is to track, keep people safe. The point of this data is to see how we can control the spread. I can go out there and say, hey, right now in North Carolina, 97% of the people will not die with this. And that is true because the numbers say 97 or 96.5 or something percent of the people will not die with this. I agree, but that doesn't mean anything. I mean, it's not going to help you in the long term,
Mm-hmm.
So that's my concern with the recovery rate. And it's hard to find it. Let me put it that way.
Yeah. No, I see that challenge as well. I mean, look, they're having a hard enough time just trying to take a census right now. But I do see this. But it is data that we're studying more carefully than we ever have before, and it is all this data is impacting our policy and the phases that we're in. So there is a tremendous amount of pressure to make sure this data is right. Doc, are any other final thoughts you have before we get off air today?
So there's one more thing I wanted to talk to you guys about. This has now, something that I was made aware of now, something we really don't think about. There are all these physicians that take care of physicians and nurses, like in Lenore, for example. If you look at the hospitalist, 80% of them are foreigners who are on a visa. Okay. Now, I don't know if you know this. If they get COVID-19, let's say they die or they get disabled, they cannot get disability, and if they die, or they get disabled, their visa expires and they're forced to go back to wherever they come from. They have no option to stay here because they don't have a green card or anything. I mean, which I was, something that I wanted to tell people that, I mean, there are people out there that are fighting for you who have a lot more problems that they face because of this.
Mm-hmm. That's an interesting. I haven't heard that conversation, but thank you for bringing that up and closing out this broadcast with that. Dr. Pradeep, thank you so much for your service to our community and your time here today. I appreciate that very much. Look forward to having you again.
Thank you.
Real soon.
Thank you.
I want to say a big thank you to everybody who's watching. Certainly a thank you to Dr. Travis Town, who's our chief technical engineer. He's behind the scenes, virtually managing this broadcast. Also to Alita Thrower, VP of Operations here at Majmal Media and Neuse. Big thanks to her to help monitor the social medias, how we were able to make sure we got some of the questions. I wanted to say, make sure you text the keyword NN to 484848 for breaking news alerts. We actually sent one out a couple days ago as the governor released did his press release on the reopening of phase one that's to be in effect tomorrow at 1 o'clock. Also, we are planning another coronavirus chat tomorrow. The plan right now is that it's going to be at 2 o'clock. We have Senator Jim Perry is going to be on. The reason why we're asking him to come on, he's agreed tentatively based on his schedule, is because of the governor's phase one implementation at 5 o'clock, but also Senator Jim Perry is filing legislation this week as it relates to unemployment insurance. He's had some pretty strong words to say about the inefficiencies and ineffectiveness, so to speak, of the Employment Security Office in our state. And I want to kind of dive a little bit deeper with him to talk about what he's seeing and how the community can help and kind of get an understanding of what the bill is all about. I think it's some really important information for you on that. If you haven't already, please make sure you join our We Report Neuse Facebook group. It was tagged earlier. And as we've done before, please make sure you tag a healthcare worker. Let them know how much you appreciate them. Please share this broadcast. Thank you so much for the stars earlier, Ms. Karen Jackson. And you just do that in the comments. Really appreciate everybody for doing that. And as always, please make sure you wash your hands.